Hello, and welcome to the Cook County Bar Association's Live on Can TV. I am your host for today's show. My name is Attorney Mika Thompson, and I have today with us is Arthur Mingo, attorney at law. And we will be discussing part 2 of our conversation regarding the Affordable Health Care Act, right?
Yes.
Okay. And this is the act that was being considered by United States Congress, and it was proposed by the Republican Party this year. So, in continuation with that conversation, I am going to discuss, we're going to start from, because we already discussed the definitions and the purposes for the Health Care Act. So we're going to go from that and discuss more details about some of the issues that we weren't able to address.
Okay.
I do want to inform the viewers that this show is sponsored by the Cook County Bar Association, and that is the bar association that is the longest association in existence, that is founded and supported by African American lawyers and judges in the United States history. And we take this time every Tuesday night at 6 p.m. to discuss issues of legal import to Chicago and the United States in general. And again, today's topic of discussion is the Affordable Health Care Act. Now, if you have legal issues that do not pertain to the Affordable Health Care Act and you would like to speak with an attorney, you can contact the Cook County Bar Association and go to their website. It's appearing in front of your screen now. It's cookcountybar.org, and you can click on lawyer referral, and there is a list of licensed attorneys that are licensed in the state of Illinois and are members of the Cook County Bar, and their areas of practice and their contact information. You can also call the Cook County Bar Association at 312-630-1157 and press 21. And you can also receive a referral from a staff member of the Cook County Bar by pressing 21. Okay. One other thing that I would like to inform our viewers is that although I'm an attorney and Arthur Mingo is an attorney licensed here in the state of Illinois, we at this time do not represent your interests. Any conversation opinions that are expressed here do not reflect the opinions of the Cook County Bar Association, the board members, their staff, and the associate members of the Bar Association. We are today talking about the Affordable Care Act, and we are giving you just general information regarding the details and the specifics of that act. And it's important because the health care is still an issue for the United States citizens today. And Congress will be considering, according to President Trump, another version of the Health Care Act. And the intent is to continue his satisfy one of the campaign promises that he made to reform the health care opportunities that exist here in the United States currently under Obamacare, or the what is the
Affordable Care Act.
Affordable Care Act.
ACA.
The ACA.
The ACA.
Okay, so in order to make this more clear and reduce the amount of confusion, we're going to refer to the AHCA as the Republican Health Care Act, and then the Obamacare or the ACA as the Democratic Health Care Act. So, our first question to Mr. Mingo pertains to the regulations and the possibility of regulations being a means by which the ACA can be modified, or that could the AHCA, the Republican version, be modified by regulation. So my question to you, Arthur, the Health and Human Services is headed by Tom Price. Could he repeal the ACA or the Either one of those versions by regulation. Can you do that?
Well, the American Health Care Act, which was the Republican plan, it's not law yet.
Okay.
But the Affordable Care Act, or the Democratic plan, is the law of the land. Secretary Price, he could not unilaterally decide that it's no longer the law of the land. However, the way the ACA was created, it gives him a lot of leeway in how he can implement the law. The biggest area in which he could hobble the Affordable Care Act deals with the employer mandate. The way the Affordable Care Act works, you have to have a lot of people in the system to cover. You need a lot of people, so you need a lot of healthy people to cover the sick people. And so one of the ways you do that is that you tell employers you must give your employees health insurance. What the Trump administration has currently done is that they have decided to, they can't get rid of the provision. They can just choose not to enforce it.
So the provision that you're referring to, it currently exists.
Yes.
And it is law
Yes.
right now. Okay.
Yes. But the way the ACA was drafted, it says that the Secretary of Health and Human Services has that responsibility to make sure that's properly enforced, but it gives that person a lot of leeway. So Secretary Price could say that, we are not going to enforce it right now because the market can't handle that. So the Secretary has a lot of leeway when it comes to how they can enforce that provision as well as other provisions.
Okay, looks like we have a caller. Caller? Hello?
Yes.
Okay, what is your question, caller?
Yes. My question is this. Everybody complains about how much it costs, and it's going to go broke. Well, wouldn't it be better, or even the right thing to do, is just to keep United States citizens on there instead of all these other people? And they're all on there. Illegal aliens, Syrians, all the people that come from different countries that are trying to get into this country, get all the benefits, and yet it's a shame that veterans like me have a hard time even going to the veteran hospital to get good care. So wouldn't it be better just to keep Americans, improve it, and this way all that cost would go down? Thank you.
Okay, caller, are you still there? Okay.
All right. So I think I understand your question. Your question is, should we just worry about United States citizens first and let that be the main focus of the Affordable Care Act?
And then he's looking for some sort of provision that would prohibit people who are born in a different country from being eligible to receive health care here in the United States. Is that what?
I think that's what he's saying.
Okay.
But his question brings up a lot of issues. So the first deals with veterans. Veterans have contributed greatly to our country, especially over the last 10 years with the long wars that we've had in Afghanistan and Iraq. And what the Department of Veterans Affairs has not done a particularly good job when it comes to health care for vets. The Affordable Care Act, to a certain extent, doesn't really deal with veterans. And the reason why is that the Affordable Care Act is more for the general population than it is for a subset, which would be veterans in this particular case. However, Congress is taking up legislation to see if they can rework the way Veteran Affairs deals with the health care for vets. However, right now, the current Secretary for Veterans Affairs, I can't think of the person's name, I'm blanking right now, has started an institutional review of policies and procedures to see, under existing law, where can I make improvements at. The last issue was the issue of people who are not U.S. citizens who get health care. Unless we change the underlying law, people who are not U.S. citizens will have access to health care, but they're going to have access to the most expensive way possible, and that's going to be the emergency room. So, but when you're buying health care does not require that you be a U.S. citizen. It simply requires that you have the ability to pay. So there are a lot of people who live in the United States legally who are not U.S. citizens. They're permanent residents. And of course, there are people who are here who are not permanent residents. But they are going to get sick. And so it becomes a question of what is more important to you, the dollars or the philosophy. If we care about the dollars, then it's still better to make sure that these people are purchasing health insurance.
And contributing to the cost of providing that service to them. And so that we're not having to foot the bill every time they come into the emergency room.
Right.
If they are part contributing by making payments to the healthcare system, then that's what you're saying.
Yeah,
right?
their premiums go to the pool just like everyone else. But if your issue is more of a philosophical issue, then at that point in time, the only solution or the only way that you would get that type of resolution caller would be to have to change the underlying law. But such as it stands right now, the way the law is drafted, it doesn't say citizen. I believe it simply says person. And person is such a broad term. It includes someone who is both a citizen, a permanent resident, or who is here, who doesn't fit either of those categories.
So they can also, illegal aliens can pay
Yes.
for their healthcare needs along with everyone else.
Yes,
that needs to pay for their healthcare needs. So I wish he kind of had stayed on because we do would need to clarify his question. So caller, if your concern is that it costs too much and we don't need to pay for them, then the law as it stands addresses your concern, because those who are illegal, that are temporary citizens, everyone who's here pays for, they have the opportunity to pay for their health care needs. If, like Attorney Mingo stated, it's a philosophical question and you just don't want them to have the access to health care in the United States, then we pay for their health care needs. And we will willingly pay if they catch some sort of communicable disease that anybody can catch simply by them riding on the train and sneezing. We're going to voluntarily and willingly pay for their health care because we don't want that disease to spread and become an epidemic.
Right.
We don't want them in the school systems without their proper vaccinations, the students having their proper vaccinations, because they get the measles and the different things, and then that spreads. So we don't want that. That's not good for any American citizen. So, and all of those vaccines, those services, that costs money.
And it's cheaper. It's cheaper to deal with it on the front end. It's cheaper to have people
them contribute,
to be immunized and to contribute, because I think that. And just like I said, I understand the core of his concern, but as Americans, we are a very giving people, and so I don't think that members of Congress, or the majority of members of Congress, be willing to say that if you're not a U.S. citizen or if you're not a permanent resident, that you can't have health care. I don't think that is a part of who we are as a culture, as a nation. And so because we're never going to go down that path, then we have to ask ourselves, how do we keep costs as low as possible? And the way you keep costs low as possible is that you get them to pay taxes, you get them to have health insurance, because if they're paying health insurance, because you don't have to be a legal resident to pay health insurance. If they're paying health insurance, they're making their monthly premiums, which means that there's more money in the pool for everyone, you and myself, which means that when one of us gets sick, the pool is a little bit larger to deal with those type of issues, which is true for that person as well. Because if that person does not have health insurance and they continue to live here, when they get sick, what is the natural thing that people are going to do? They're going to go to the emergency room. And if they don't have health insurance because it's a violation of the law and they don't have the money to pay those huge hospital bills, then at that point in time, those costs are going to be passed on to you. So it's going to cost you more money to exclude them. It will actually be cheaper to have them be a part of the system.
Right. Okay, so our next question is, does the Republican Health Care Act, did that require that prescription drugs are covered? Or do we have to pay for those separately?
The way the Republican plan worked, so it's interesting. The Republican plan basically took all the things that people liked about the Affordable Care Act and said we're not going to mess with those. The things that people didn't like, which paid for the goodies, they want to get rid of. The Republican plan continues a policy that the United States government has had for the better part of 20 years, which is that Medicaid cannot negotiate for cheaper rates for prescriptions. A pill in the United States is more expensive than practically anywhere else in the globe. And the reason why is that our European brothers, Canada, what they tell big pharmaceutical companies, you all can make a profit, but you cannot make an excessive profit. The United States does not have that rule, so we just buy it at whatever the pharmaceuticals charges is what we buy it at. We can't negotiate for a lower price. But the Republican plan, or the AHCA, doesn't change the underlying rules of the Affordable Care Act, which is that there has to be a way for people to be able to afford their medication. So that doesn't change. But I did want to talk about something that we talked about earlier that I didn't get to really talk about.
So wait a minute, just want to make one
Sure.
point. The proposal that President Trump, the king of negotiation, put forth did not allow them to negotiate.
No, that's current law.
Oh, okay.
That's
okay,
current
that's
law.
current law.
That's
and that
current.
and that wasn't changed by this. Okay.
Yeah.
Okay.
The
Now I
Affordable Care,
understand.
the Affordable Care Act didn't change that rule, and neither would the American Health Care Act. The pharmaceutical companies, their reasoning is this: that these blockbuster drugs are very expensive to research, test out. You have to go through the process of making sure that the product you think is viable, that the FDA signs off on it, and then you have to market it, and then you have to make a profit. And they say that's the reason why these drugs cost so much. There's the fable, which is actually true, of the $1,000 pill. For people who have hepatitis C, there is a treatment for it that will cure you, but the pill costs $1,000, and you need 86 pills. You have to take one pill every day. And
Really?
yes, it's called the $1,000 pill. And the reason they picked $1,000, they make it very clear. They picked $1,000 because it was a nice round number. That was the reason why they charged $1,000. But when you look behind their facts and figures and you find out how much it cost them to research, get approval, market, their cost for that actual pill is closer to be around $700. And if you add on a bit of profit, they're going to get to $800. So they're charging excessive prices. Why? Because they can. Because we as consumers, we will spend whatever it takes to stay alive. But Medicaid is unable to negotiate with those people for a lower rate, whereas private insurance can. And that has been United States policy for a better part of 20 years. And pharmaceutical companies say, if you want us to continue to debut blockbuster treatments here in the US of A, then we need to be able to have that free ability to charge whatever we think is an appropriate rate.
It looks like we have another caller. We're going to get back to that. Caller, you're on the air. What is your question?
Yes, good evening. I just called. And my question is this. I guess I didn't explain it too well last time. Listen, I'm Mexican-American. I fought for my country. I'm a veteran in Vietnam. And I don't care who gets treatment here. But they should be citizens, period. No, they're not the residents or no, they're not citizens. All veterans want is a fair shake. We can't get it from the VA.
So, caller, are you still there? Okay.
All right. Well, in regards to veterans, first of all, I want to say thank you for your service.
Thank you.
But when it comes to veterans, the Affordable Care Act again didn't really touch veterans' issues. The issue that veterans have deals with the VA. The VA it's a department that's sort of been cobbled together from other departments, and they have never went through the process of streamlining how they deliver services to people. There are veterans all across the globe, veterans who are both citizens and non-citizens in the United States. And the way the VA system works, it's a very antiquated system, and that's something that would be a conversation for another time and topic. But if you're talking about how does the VA deliver health care, the way they deliver health care is completely different from the way the Affordable Care Act works. That isn't really a provision of the Affordable Care Act. If your concern is about people coming in and getting free government health care who are not U.S. citizens, namely Medicaid, Medicare, and the S-chip, the reason that we do that is that, again, it's sort of who we are, that we're not going to let you just sort of die on the side of the road. If your concern is whether or not someone who's a non-U.S. citizen is buying health care, buying health insurance, which means they're not getting it from the government, at that point in time, that's just the marketplace doing the marketplace. You know, we open our doors of commerce to anyone who wants to buy a product from us. But if your concern is about how vets are treated, that is a Veterans Administration issue. But if your concern is about lowering costs, then you want anyone who's in the United States to have health insurance of some type. But if you're having a more philosophical argument that we just as a people should not do that, I think you're going to have a hard time winning people over, because what's going to happen is, and it's sad to say, you're going to have someone who's going to die of a disease in a very public place, and everyone's going to ask, why didn't they go to the hospital? And then your philosophy is going to run into that issue of them saying, well, because they were not U.S. citizens, we didn't cover them. People are going to get really outraged by that, and that's going to be a very difficult issue to push for. And that's why I don't think that you will see people who are not U.S. citizens be denied health care, because at the end of the day, no one wants to know that we as a country don't allow that to happen by matter of law.
And the other problem is that not allowing members of the public who are living in our society access to health insurance is expensive for everyone. It creates a larger burden on the health care system, and when we really need to have more money to spend on veterans, to spend on our youth, we need to have everybody chip in as much as possible. So to the extent that some of the illegals and the non-citizens have the means by which to contribute, they need to contribute. We need them to contribute. This has gotten to a point where we cannot afford the free rider system that we've had for so long. We need everybody to contribute to the extent, and for the most part, I'm hearing a lot of citizens in the news and in everyday walk of life wanting to contribute. They want to contribute to their health care. But there is a point where they can't. It's gotten to be too expensive. So the things that Arthur Mingo is talking about, where we as a nation could negotiate rates for pharmaceuticals, brings down the cost. We can make sure that everybody is contributing to the system. We are expanding where we need to Medicaid for those that need a little more assistance. And we need to do those things. We need to take advantage of those things. So continuing with our conversation, I also want to talk about, and this goes into the affordability of the healthcare system. What is your opinion with regards to allowing these the state governments or even the federal government to purchase the prescriptions across the state lines? Is that something that we can do? Do you know what I'm talking about?
I do.
Okay.
So I just want to say from the outset that you can purchase any drug or pharmaceutical that's available in the United States regardless of where you live. However, what the federal government does not do is purchase it from, everyone likes to choose, Canada. We do not do the reimportation of drugs.
Okay.
That's a violation of federal law. And the reasoning is that the FDA's position is that if we were to allow people to go across the border to whether it be Canada, Mexico, Europe, Asia, Africa, or Australia and buy drugs, we can't make sure that what you're buying is exactly what you're supposed to be receiving.
Okay.
So for the FDA, they fall back on the safety concern. The pharmaceutical industry,
And the FDA stands for what?
Food and Drug Agency.
Okay.
The pharmaceutical company, their argument is a bit more nuanced. Their argument is that essentially the United States of America is the bank for the world when it comes to pharmaceuticals. And everywhere outside the U.S., they're operating on a very slim margin. But inside the U.S., because of the very lax laws when it comes to pharmaceutical pricing, the U.S. allows pharmaceutical companies to save up enough money to do the research for the next big drug.
So you're saying the drugs that are purchased by other countries are in some way subsidized by the federal government?
Not by the federal government.
I mean,
by U.S. citizens.
Wow.
By U.S. citizens, because, for instance, I don't want to name any drugs lest I get in trouble, so we will come up with drug X. Okay. Drug X is developed and is sold across the world. All right. In Europe, Canada, and Asia, that pharmaceutical company will only make a 5 to 10% profit after you account for research and development and marketing. In the United States, they could see upwards of 20 to 70% of profit. And what the drug companies are saying is that large profit may sound shocking to you, but what we do is we use that large profit margin to research our next big blockbuster drug Y. And if you were to cut out that generous nature that the United States has and put the way we negotiate more similar to what the Europeans do, At that point in time, it will take those large companies longer periods of time to save up enough resources to do the research for the next big drug. And in the meantime, people are going to be passing away.
All right. Well, that will be our last statement for our end our conversation today. Thank you for tuning in. Thank you, callers, for calling and asking questions. We will be here next week on Tuesday at 6 p.m. and we'll be talking about another issue of legal import to the Chicagoland community. Thanks again, Arthur Mingo, and thank you, staff member of the CAN TV station, for being the phone tech for tonight's show.